All right. Good afternoon, everyone, and welcome to our November 2022 State Advisory Council meeting. My name is Morgan Crossman, and I'm the Executive Director at Building Bright Futures, which is Vermont's Early Childhood State Advisory Council. And just for a couple of housekeeping items as we get started, I do want to ask that our State Advisory Council members have your video or your cameras on if possible. And if you are not a current member of the State Advisory Council, that you turn off your video. Just really hoping to build some more connection between our SAC members since we are not yet back in person. So thank you all. All right, and as we get started, I want to just briefly share what you can expect for today's agenda. So we have very brief council business with a vote on SAC minutes. We want to spend a little bit of time marking the progress we've made in our Vermont Early Childhood Action Plan because we're about halfway through our 5-year strategic plan. So we're going to do some breakdown into pairs to have a discussion about progress that we've made. We'll have a brief section where we're going to be inviting our State Advisory Council members to share any upcoming legislative priorities that you're either tracking or thinking about coming into this session. And then we have a really exciting network spotlight on how we have just had a really great experience elevating family voice as part of how we monitor and advise related to children and families, both on the state and the national level. So before we get rolling, it's BBF's tradition to start with a mindful moment. And so as we are coming together on a Monday following Thanksgiving, we are so grateful that all of you are here to join us today and everything that you are bringing into this space and into the world, and especially as you are really incredible champions for kids and families. So if you want to take a minute to turn off your video, I invite you to do so now. And I want you to be able to sit comfortably in your chair or in your position wherever you are. Close your eyes and try to bring awareness to your breathing. So take one big breath through your nose and through your mouth. Become aware of the air that's filling your lungs and the blood getting a little bit richer with that air. And follow the blood as it flows up to your brain. And imagine that every inch of your body is lighted by that breath of air flowing through your body. Travel with it through the brain and down to your toes, and then feel each area of your body start to loosen and relax as you breathe. And whisper to yourself the mantra, I am grateful. All right, I want to invite you all back into the virtual space. Again, SAC members, please turn your cameras on if you're able to. And those of you who are not State Advisory Council members, I'd ask that you leave your cameras off until a little bit later in the session. I'm going to turn it over to Flor Diaz-Smith, who is our private co-chair, to do some of our council business this afternoon.
Good morning, everybody. It's nice to be here with you. I'm grateful to be here. I serve on behalf of the Vermont School Association. I'm the private co-chair of the State Advisory Council, and we're going to invite our members to introduce themselves via roll call. We will start with our public partners. Kate Rogers, Agency of Education. Kate is retiring next month. Kate, thank you for your service and your commitment to our children and all our families.
Thank you.
Okay, Renee Kelly, Head Start State Collaboration Office.
Good afternoon, everyone. Renee Kelly, Director, Vermont Head Start Collaboration Office within the Child Development Division.
Thank you, Renee. Lisa Stalberg.
Hi, everyone. I'm Elisa Stolberg. I'm the Director of Maternal and Child Health at the Health Department.
And I can't see everybody. I'm working from my iPad, so please just chime in. Sarah Truckle.
Hi, everyone. Sarah Truckle, Director of Program Strategic Operations for the Agency of Human Services.
Thanks, Sarah. Miranda Gray. Okay, I don't hear Miranda. It's Susanna Davis. Senator Ruth Hardy. I saw you. Yeah.
Hi,
Thanks, Floor. Senator Ruth Hardy from the Addison District.
Representative Jessica Brumstead.
Good afternoon, Jessica Brumstead representing Shelburne.
Thank you. Rebecca Webb.
Hi, I'm Becca Webb. I'm a Universal Pre-K Coordinator representing Early Ed and Early Childhood Special Ed.
Eddie Gale. I see you. You're right under my square.
Hi, Eddie Gale with the A.D. Henderson Foundation.
Amy Johnson.
Hi, Amy Johnson, Director of the Parent Child Center of Northwestern Counseling and Support Services, representing the Vermont Parent Child Center Network. Hi, everyone.
Christy Swenson. Alexis Duquette. Libby Dalian. I saw your
Hi, everyone. I'm Libby Dalian, a parent representative, and I also work at the Flynn.
Dr. Ashley Miller. Janet McLaughlin.
Hi, everybody. Janet McLaughlin, and I'm here as the Executive Director of the Vermont Association for the Education of Young Children.
And your helpers, are they going to introduce themselves?
My helpers seem to have faded away.
Okay. Paul Dragon.
Everybody, Paul Dragon. I'm with the Champlain Valley Office of Economic Opportunity. Nice to see everybody today.
Mike McRae.
Hi, folks. Mike McGrath from the Vermont Principals Association.
Heather Wilcoxon.
Hi there, Heather Wilcoxon. I'm from HCRS, Assistant Children's Director.
Dimitri Gardner.
Hi, everyone. Dimitri Gardner with Global Z International in Bennington, and I am the business representative.
Hey. Arika Radkill. Kendall Smith. I also wanted to note that a few members sent their regrets. Jessica Binter from the Agency of Commerce and Community Development. We have very little business today. So I'm going to see if you guys all had a chance to look at the minutes. And if I could ask for a motion to approve the minutes of October 24th.
I move that we approve the minutes.
Thank you, Janet.
I'll second that motion.
Thank you, Heather. Any discussion? Okay, all those in favor, please signify by saying aye.
Aye.
Hi.
Any opposed? Hearing none, the motion carries. Thank you very much.
Awesome.
Yeah. We had any abstentions? I didn't ask for abstentions. I'm sorry, but there was no discussion, so I figure everybody was here, according to my notes. We have a few network updates. First, we are conducting a membership survey extended from last month. For everyone on this call, please take a moment to complete it. Morgan or Beth, could you post it on the website? Great. Second, the December meeting will be held on Monday, December 12th. This will be the annual Regional Council Summit, where we will gather with representatives from the 12 Building Bright Futures Regional Early Childhood Councils to discuss topics such as family safety, mental health, and access to basic needs. And here's the invitation too on the chat and the link to register. And with that, I'm going to give it back to Beth, and I'm joining you from Guatemala.
Thank you, Flor. Gracias. Joining us all the way from Guatemala, visiting family.
So good afternoon, everyone. I'm Beth Trzanski. I'm the Deputy Director of Building Bright Futures. And one of the things that we want to take an opportunity to do this afternoon is that it's quite surprising, but we are nearly halfway through our 5-year strategic plan, our Vermont Early Childhood Action Plan. Can you believe that? Many of you were very involved in the update of this plan, which took a lot of work. So thank you for those of you who were involved. This is our 5-year strategic plan, which outlines 4 goals. And so sometimes it's hard to talk about the Vermont Early Childhood Action Plan because there's so much there. But it really serves as our roadmap. It's a living document. We are constantly making course corrections and recognizing kind of where we want to lean in, where we need to make adjustments, what we want to change in future iterations. But it was a real gift to be able to use that plan to guide, in particular, the most recent preschool development grant proposal, which is really grounded in the VCAP. So we both want to take the opportunity for SAC members and for all other partners who are joining on this call. We're going to divide up into pairs to be able to take a little bit of a closer look at how are we doing? What kind of progress have we made in the last 2.5 years, and where do we want to lean in? We do ask this question on occasion, right? Because we want to be reminded that this is our plan, right? And we don't want it to just sit on a shelf, that we want to use it, and think we've been doing a fair job at pulling it out and really being able to look at different aspects of it. So I do want to quickly share, we sent out with the advanced materials a strategic plan inventory. So let me just bring this inventory up, which provided us an opportunity to look at the VCAP and think strategically about what we are, what are some accomplishments and some areas of learning. Now, keep in mind, this is not fully kind of encompassing of all the accomplishments of the VCAP. When we were writing the preschool development grant, you can imagine that we were elevating progress that really called alignment to areas that we were writing for in the grant. So if you see something missing, we'd love for you to note it, and we have idea boards to help kind of capture where you feel like there's progress. But did feel like this was a pretty cool activity, especially in light of writing the preschool development grant. So essentially, for each goal, we identified just a few areas of progress or accomplishments or kind of shift in strategy that we've seen, that we could demonstrate, again in line with what we were writing for the preschool development grant, some lessons learned, and then we called out a few of the indicators for each goal. So that's what I'm sharing right here. We also have this online, and it went out with the advanced materials. So I don't know if this is familiar. Sometimes it's a little bit easier to take the VCAP in these kind of bite-sized pieces. So what we're going to ask you to do, I'm going to bring down the share so that you can see me, is to look at the inventory or pull up the full VCAP if you want to, and we can put those links in the chat. And we're going to divide you into pairs. SAC members more or less randomly. So hopefully who you're paired with is able to kind of show up. And for you to really choose one goal that you might be more familiar with the work, and to think about, introduce yourself to whoever your buddy is. And think about one goal where you want to focus on, and how are we doing to reach the objectives outlined in the 2020 VCAP. So you can really just pull out some, one piece that really calls to you or calls to your partner, so that we can look at that. And then we're going to try and capture that inventory in a idea board. So I'm going to put in a few links in the chat here.
Beth, just so you know, the link to the VCAP inventory is not the correct one. So we're working on that right now and we'll send it back out.
Okay. So I will put in all the other things except for the VCAP inventory. Any questions about how that? So the link to the VCAP is here. And we'll give you, let's say we'll take 15 minutes. So that's the VCAP. And then this is the idea boards. Are folks familiar with the idea boards? I will do a screen share so you can take a look at that. While I know we're asking you to bring up a few things.
And we're also recognizing that the reason the links are not working is because our site is down for a minute. So I just wanted to flag that for folks. If you are having the same error messages, I'm getting something on our internal server saying that things are down. So I apologize.
Oh, darn site. Okay. So this is idea boards. We've used these before, but essentially it's kind of like your virtual sticky note. So we've divided this into 4 kind of quadrants and under for each goal. So if you have something that you want to kind of elevate as something that as an accomplishment or kind of a step towards that objective, you click on this green plus sign and it pulls up a virtual sticky note, and then you can add your accomplishment here. Okay, so if in your pairs, feel free to kind of have discussion and then add a couple, 1, 2, 3 sticky notes as you see in under that goal area. How's that sound? Okay. So Dora was going to set up the small groups. And let's see if you can't bring up the inventory and just want to look at the VCAP, you can do that as well. Okay. So we will. How was that? Hope you got to talk to someone new or maybe someone you haven't seen in a while.
I talked to Libby. It was awesome.
You got to talk to Libby. Awesome.
Yeah, we were like, oh, yeah. I don't get to see her very often, so it's good.
Wonderful. So as people rejoin, I would invite just a few people to share. Thank you. Well, first of all, thank you for helping us document where you see successes and progress and in the idea board. And if you weren't able to access that, just let us know and we can enter things in. But I would love to hear if there's some sharing of a success that you are helping us document. Or an observation as you're looking at the idea board. I'll invite the SAC members to share first. Is there anyone who wants to share something that you talked about in your pairs about progress towards the VCAP?
Well, I'll just say the one thing I shared was the reimbursement, the workforce retention bonuses that we got from the state, because we have a Head Start program, very well received, and we really, really appreciated it. So I think that whole section of trying to retain workforce, to better coordinate, to better value staff is really super important in this field particularly.
Thank you, Paul. That's great. Yes, Jessica.
I would say that we sort of talked all over a bit the goals. I talked with Ilsa Stahlberg, and we really talked about the incredible amount of data that Building Bright Futures pulls together from all over the state and helps us to think bigger than our community, but also think about how do we link things together? You know, where do we go from here? How do we even make it bigger so we can follow some of our kiddos forward and see how they're doing developmentally as well as in general, and linking, the health department's work with the Agency of Human Services, with the Agency of Education, so we see the impact we're having on our kids. But
That's great. And that's exactly the point of the goal 4 of the VCAP, right? Which is this early childhood system will be integrated, well-resourced, and data informed. So that's wonderful. Thank you, Jessica.
Full disclosure, though, we didn't put anything on the board.
Okay, well, you have some time. You and Elisa can add something if you want to.
Okay.
Thank you. Dimitri.
Yeah, so touching on that point, Sarah and I talked quite a bit about the resourcing and the data, in particular around public investments. And part of the challenge is in the measurement of the outcomes that we're looking for. And again, coming from the business perspective, framing this as a return on investment, I think has been really effective in getting business attention and support on the issue, but demonstrating that in ways that can be measured in the short term and in the long term is the challenge. However, I shared a few anecdotes about where there are some early wins that employers are seeing when we start to make investments in childcare. And the example I used was from Smuggler's Notch, who offered paid childcare for all their staff and immediately started to see positive impact on their workforce. So those are the types of stories I think that we can really use to show that, yes, while there are long-term impacts, there are also fairly immediate impacts that we can measure as well. And I think we just have to do a better job in my community of getting those stories out there.
Dimitri, I really appreciate that you're calling attention to the fact that there are multiple kinds of data, right? It's not just quantitative numbers, that stories and community voice is really important in the conversation. And how do we do a better job of capturing qualitative data to support some of those efforts? And I just want to note that we will be doing this exercise continuously. So if you have not yet documented it in the idea board, it's something we want you to do, and there will be other opportunities to capture this information. So I appreciate it.
Thank you. Ruth, see you have your hand up.
Thank you, Beth. Yeah, and Dimitri, I would love to talk to you more about the point you just made. I agree completely with what Morgan just said, and we're going to need those stories in the legislative session coming up. So we should connect on how you can help us with those stories to get a bill across the finish line. We talked, one thing in the first section, all children have a healthy start. I added that we created a program that provides prenatal, postpartum, and pediatric services to Vermonters who are undocumented. And this was a big win in the first year of the last legislative session. And I think it's important to note that, especially when we're talking about all children, and we're going to work to include those kids also in the CCFAP program this session. We did talk about a couple of things that need to be done better. And one was to include the DAs that are providing early childhood family mental health in CIS in the ASQ online system. Apparently they're not all included or not included at all. So the DAs need to be included in that system. And that there should be more emphasis, and that was under the first all children have a healthy start. And then under goal 3, there should be more emphasis on school-based and community-based services for young children with mental health and developmental needs. So the connection between the school programs and the community programs and families didn't quite mesh, hasn't quite meshed as much as it needs to.
Thank you. Those are really important areas. Becca and then Libby.
Kate and I got to have a really great conversation, and I did drop this stuff into the idea board. I think part of what we talked about was really recognizing the need for that integrated data system, right? When we look at we focused the first part of that on the indicators in goal 1, and really questioned how valid the ASQ data is. In terms of, is everybody in the system? Where's the number getting from? And then we had a really great conversation about how it was really a birth to 5, but we didn't make it back to the VCAP to see how it was phrased. But that kind of crossed over across the other 4 goals that we looked at, was really the importance of having good, strong data across our systems that talk to each other.
Thank you. Libby.
Hi, so Flora and I went through just all the different points, and we're kind of reflecting overall that there's a lot of really positive evidence that data is being used and has really become an important part of decision making and the conversations that are happening. And even the areas where maybe we haven't achieved the goals yet, like producing an unduplicated count of children receiving EC services, it's an accomplishment to be able to identify that as an issue. So seeing some of those things was positive. And then there were also areas, maybe especially for me since I'm newer to this information, but some places where the indicators could maybe use some more context around like developmental screenings, what counts as a developmental screening and in which different settings. So and percentage of children receiving financial assistance, like, is that an improvement? What's that number out of? So some of those indicators, contextualizing them a bit more, but overall, like a lot of positive work happening.
Excellent. Well, thank you for those who shared and for the additions in the idea boards. Again, this is something that we will continue to do. It is the work that the VCAP committees do in more detail. They really get more familiar with the goals and objectives that are in the Vermont Early Childhood Action Plan. So if you're not involved in at any of those tables, you're invited. But thank you for taking a few minutes both to connect with each other in a way that sometimes is hard when we're meeting virtually. And for us to kind of take stock on what are we seeing are some of the key accomplishments that can also indicate kind of where we want to put our energy into the future. So I appreciate the time that you took. So feel free to continue to add to the idea boards if you haven't. So with that, we're gonna move on with our agenda, and I'm gonna hand this over to Anna.
Thank you, Beth. Hi, everybody. Good to be with you all today. Anna Brulette. I am VBF's Policy and Program Director. And we're going to shift gears a little bit and talk about legislative priorities. And given the time of year, we really just want to kind of open the floor and give folks an opportunity to hear from each other, particularly for SAC members who are involved in policy or advocacy oriented work, to have an opportunity to kind of elevate their priorities or the work that is happening to prepare for legislative session, and really kind of hear about what your teams are monitoring or working on related to the upcoming legislative session. So first, I'm going to open it up for SAC members to briefly describe their priorities or work happening, and then we'll perhaps have a couple of minutes to take more general comments from other folks on the call with us today. In our February meeting, we'll be kind of dedicating a longer period of time to hearing from some of our advocacy partners, including the Alliance and LGK and Vermont AUIC, about kind of the progress up to that point. But right now, we would love to kind of just hear initial priorities and how folks could either, get involved in that work or get updates about that work. So I will open the floor. Any SAC members would like to share?
You can put me on the list and I don't need to go first if others want to go.
All right, thank you.
Amy,
Mike.
you go.
Amy can kick us off, and then I'll go to Mike.
I've never used the hand raising function until just this moment, 2.5 years later. Fun new skills. So the Vermont Parent-Child Center Network is very active in the legislature. We had a very successful year last year, many thanks to our amazing legislators. This year, we're coming back with an ask of $5.2 million to bring our integrated grant up to 10 million for the 15 parent-child centers. And so this is really focused on that home and community prevention-based work. It supports our 8 core services, and we're really focused on wage parity. And so a big piece of what we've done is looked at our wages across the 15 parent-child centers and comparable work across the state, and kind of where those disparities are. And so we've kind of chipped away at this over time, but we're still underfunded. And so that ask is $5.2 million. I don't want to take up too much time because, you know, I could talk about this for a really long time, but you'll definitely see me in the legislature and I'll talk about it there. But if people have more questions, just let me know. So more money for prevention work. Yay.
Great. Thank you, Amy. That was perfect. Mike, you are up next. Put you on the spot.
Yeah, great. Thank you, Anna. Thanks for the chance. The two things that lots of different things, right? But the two things I want to share with this group are the workforce issue, which I've been a broken record about here. And I sent this out to the SAC members last week or 2 weeks ago. And I'll just throw it in the chat again. This is a press release that the VPA issued around the importance of focusing on educator workforce, which certainly would include early childhood. And we continue to see this as a really useful strategic investment that probably wouldn't take much. And we haven't seen that investment directly as a coordinated approach. It comes on the heels of the McClure and Department of Labor report that they do each year, the annual report, and it listed teacher as the #1 most promising job projected almost by double in the next 10 years in Vermont. And that's an opportunity, and it also is a crisis, as you all are fully aware of. So that's one. And then the second thing that I think is most germane for this group is the VPA has long advocated for universal preschool in schools and full ADM to go along with that. So right now we essentially have 10 hours, as you all are very familiar with, and we just want to see that expanded. We want to see priority for highest need students having full access to that. And we think that the current delivery model, though well-intentioned, is not actually serving as well as it could, or even as well as it was intended. So those are some of the things that are on our mind.
Excellent. Thank you for elevating those things, Mike. Any other SAC members, even things you're just, monitoring and kind of thinking about how they're going to play a prominent role during session this year and keeping an eye on that are relevant to our work as a council? Yes, Flora, I see your hand.
Sorry, I was trying to figure out how to raise it. So I guess one thing that I will add to what I agree with everything that Mike shared. One thing that I would add that is in our radar is the use of public fund money around pre-K, around summer programs, around everything to make sure that the use of public money has the same. Everybody plays under the same rules as using public funds for providing care for our children and support to our families. I know I sound like a broken record in that, but you know what?
Thank you, Flor. All right, any other SAC comments before I open it up to other folks? Heather, I see your hand.
Yeah, I just want to continue to advocate for embedded mental health services at all levels, including with the pre-K as that advances in trauma-informed care all the way through the grade levels and at every level. It helps, of course, the children, but also the staff. And a lot of times the responses of the adults are because they don't necessarily understand what's happening with the child and don't understand that it might be trauma reactivity. And so they might be perpetuating it. And I think that there's not necessarily enough of those. It often ends up being relied upon by maybe a school-based clinician that might have like, yeah, much time to give a little tiny piece of support connected to a particular child or in a meeting. It's not nearly enough. And it's definitely really limited at those really early years, like the pre-K and kindergarten. And we continue to hear things like bullying from a 6-year-old. And even though they're no longer being exited from school, they're being unintentionally targeted by adults because they don't understand, and it causes suffering and perpetuates trauma reactivity, which increases symptoms, increases suffering. It makes everything harder, and it causes that trickle down effect, including for the adults, and it affects everything, including that staff retention piece, which leads to the staff shortage, which leads to the problems with needing to get new staff in and training and not having housing, just all the levels. So I'd love to continue to advocate for that everywhere. Thank you.
Thank you, Heather, for elevating that piece. That feels really critical and timely. So appreciate your expertise. Representative Brumstead, I'm sure folks would love to hear from you on this.
I've kind of been holding back on purpose, but Senator Hardy and I and Senator Lyons and Representative Wood have been meeting. So don't worry, we're listening, and we're just not totally ready to share all that we're working on, because we know that each time you do that, sort of is a step forward, maybe 2 steps forward and a couple steps back. And so we want to first get all of our ideas down so then we can talk about why we ended up where we are. But we are working very diligently on childcare legislation, of course, right? We're paying attention to the systems analysis, the marketing analysis that we're hoping to get more details on soon. Workforce needs are huge. And honestly, the work that you all are doing in the regional councils and with Building Bright Futures is having a huge impact on our decision-making as we move forward. We talk about it all the time. And we are, I can't say enough that we're listening. There are differing places that, as we all know, when you try and put together a solution to a big problem, there are people on all different sides. And so we're working hard to take all of that into consideration as we move forward, as I'm sure that the governor's office is as well, as they consider what they want to do in their budget. So we also are having some conversations along there as well. I also want to just mention that I'm also working on a reach up bill, which would look closely at the rateable reduction. You know, it's 50%, it's pretty huge. So we're looking at that. We're also looking at some housing supports around mental health for our most vulnerable families in our committee that will be coming forward. And we're also, you know, there are big and small, there are all kinds of things out there, one of them being the diaper bank and the junior league ready to sort of hand that off. And how do we do that? And what does that mean for us at a state level? But we do know that it's important. It's been incredibly helpful to, again, our most vulnerable families, and we'll continue to work on that. And would love to hear more through maybe the regional councils about application fees and deposits and how that's impacting families across, because we have been hearing from some families about that. And I know that I'm assuming that childcare centers are balancing the administrative cost of so many people now being on our waiting list, because everybody's trying to get spots for their new babies. So anyhow, I just want to reassure everyone that we're working on this, and Ruth may want to add some as well.
Wonderful. Thank you for those updates. Any additional comments, Senator Hardy?
Sure. I just want to thank Representative Brunstad. We are working really closely together and taking a lot of what we've learned here and hopefully putting it in our bill. So thank you all. I can't emphasize enough how much we are listening. And hopefully we'll have a bill that will be a start and we'll have a lot of you in to testify and add to it and change it as we go through the session. It is definitely childcare is one of the top 3 to 5 issues, probably top 3 issues, along with housing and climate issues that are coming up repeatedly with legislators. I just want to also add, after hearing from both Mike and Flor about the public school issues, and I'm happy to talk to each of you individually more in depth, but I hear you and I'm on top of those issues. So thank you for bringing them up.
Wonderful. Thank you all. We really appreciate everyone kind of sharing and making some connections across priorities going into the legislative session. We have just a couple more minutes and I want to open up the space to see if there are any comments from non-SAC members who would like to kind of briefly share what they're thinking about and prioritizing. Matt, the floor is yours.
Yeah, thanks. So I'm Matt Levin, Executive Director of the Vermont Early Childhood Advocacy Alliance. Our members are working on many of the issues that have been noted in the discussion this afternoon. And just want to note that, as has been referenced by Morgan, we'll be coming to the full SAC in February with an update on that. We are finalizing our document that lays out those initiatives that our members are undertaking that the rest of the folks have come together to support. And that will be publicly released, we think, next month. Not going to be a lot of surprises there. Again, the issues that you've heard talked about today are all on there, and the lead organizations within the coalition are working hard on gathering support and developing their proposals and working with legislators. So you'll hear more from us later as the session starts. So thanks for the opportunity to give everyone an update.
Perfect. Thank you, Matt. That's helpful. All right. Any final comments from anyone who'd like to share? All right. Seeing none, I'm going to transition things back over to Morgan.
Awesome. Thank you all. I am just getting a message from Flora that she lost power in Guatemala, so she's probably not going to be able to rejoin the call. So just wanted to give everyone that brief update. We're going to transition into our network spotlight, and I'm so excited and also a little emotional to be a part of sharing this story with you all today. It's really about how we, across all components of the work we do in this network, elevate family voice, both as part of monitoring and advising. So today we're really going to share a powerful example of how we are bringing together multiple components of our statuted role and charge. And not only is some of this work a part of our statute, but we are actively through all of our grant efforts, really focused on how we are developing true partnerships with families and elevating lived experience, as well as providing opportunities for leadership. So today, we're going to be talking about our experience heading to DC to both present research and data to elevate family voice and to advise our congressional delegation. And I am so sad to be the one speaking for a part of this section. We were supposed to be joined today by Marisa Porter, who is our phenomenal family ambassador from the Vermont Interagency Coordinating Council, who accompanied Hillary and I to DC, and she is with her sick child in the hospital. So please send all of the positive thoughts and prayers. And I will do my best to represent her and Thomas today as I talk through this part of our session. What's really exciting and what you're seeing on the screen is that Hillary, Marisa, and I went to DC to present data on families' experiences with children's integrated services at a national conference. And we also had an advisory meeting with our federal delegation, and we're just really excited to talk with you about this experience. So we partnered with the Children's Integrated Services state team at BBF to develop a data brief, again, really honing in on one part of families integrated or children's integrated services. And it was really about elevating family voice. What do we know about how this program impacts kids and families? We have a whole different session where we can talk to you about the findings of that data brief, but today it's more about the experience of submitting an abstract or an overview of that data to a national conference that was accepted, and how we partnered, the three of us, to present that data nationally at the Association of University Centers on Disabilities annual meeting. And this conference is such a unique experience where it brings together researchers, agency leaders, disability policy experts, family members, individuals with disabilities, advocates, and practitioners to discuss, the most current issues and topics related to how we support families and kids and individuals with disabilities and special healthcare needs, cutting edge research, and national best practice across the country. Next slide, please. So we met a few times before the trip and a couple of nights during our trip to really plan, how are we going to present this data? Who's going to do which pieces? How are we partnering to share this data across this poster session? So what you're seeing on the screen is Marisa and Hillary presenting this data as part of the poster session during the conference. Next slide, please. We also had a really cool opportunity to make Vermont connections in DC. So the folks you're seeing on the slide right there are some of the Vermont team, not everyone at the conference, but our family leader is in blue on the left. That's Marisa Porter. On the right of her is Dr. Valerie Wood from CDCI, a couple of her colleagues on the right of her. Hillary is to the left of Marisa, myself, and then Jesse Suter, who is the director or the executive director of the Center on Disability and Community Inclusion. And that is Vermont's University Center on Developmental Disabilities. And so it was really great because not only did we get to attend and present at this conference, but we were in the same room hearing our colleagues present on their work and being able to make those Vermont connections and strengthening those relationships and networks across Vermont as well. And through those relationship building sessions, we also were able to invite Dr. Valerie Wood from their team to join us the following day to do some advisement with our federal delegation. And what you're seeing on the left is Hillary and I doing sightseeing on night one. Next slide. So as part of our key advisory role, we scheduled time to meet with our federal delegation. So Nikhil Goyal is our primary contact in Senator Sanders' office. He hosted us and we had a really beautiful amount of time with a joint meeting of all of our different delegation staff members. So Senator Sanders, Senator Leahy, and Congressman Welch had representatives that met with the three of us. Actually, the four of us, I apologize because Valerie was there as well. And we had the opportunity to talk about Vermont's families of children with disabilities and special healthcare needs, what they are facing right now, some of the major challenges that have been experienced during COVID. We talked about mental health and the workforce crisis, and had an opportunity to, again, serve as a resource to the federal delegation to talk about our State Advisory Council recommendations and offer to be a resource as they are navigating what's coming on the federal horizon. So we had a lot of questions with them about what they are seeing and how they are planning to support kids and families in the coming year. Next slide, please. We also had a really cool, incredible experience where we got a tour of Dirksen, which is the Senate building. We met with the staff, but then we also had a personal tour of the underground tunnels, which led to the Capitol. And Marisa actually got to ring the Senate bell, and then we got to ride the train underground to be able to go into the Capitol and check it all out. So really, really incredible experience. And you know, again, I'm sad that Marisa isn't able to be here today, but go to the next slide, please. One of the most powerful sessions that we attended during the conference itself was led by an author and an individual with a disability, an advocate, a really powerful professional in the field. and it was on the power of storytelling. And one of the most important takeaways for me during that session was that it's important to know when it's the right time for you as an individual to tell your story, for you to know when it's important to elevate someone else's story, and when it's important for you to lift someone else up to tell their story. And so, again, you know, I feel very honored and privileged to be able to share Marisa's story, or a little bit about her story today. And I'll do my best with what this author named supported storytelling. So again, how do you tell someone else's story with respect and honor? And Marisa was so gracious to be able to provide photos today. And I am going to be reading some of her reflections of the time that we spent together in DC. And we'll hope to have a couple of other sessions coming soon. So in terms of Marisa's story, who you are seeing on the screen right now is her son, Thomas, who was born with Down syndrome, and Thomas also has type 1 diabetes. And her family has such an incredible story that I can't wait for her to also share with you about why they came to Vermont and how they were immediately wrapped in services and supports for their family and their child who had significant special health care needs, and what that meant for both their child, but also their family. And you'll hear a little bit more from Hillary in a few minutes about how Marisa got engaged in this work. But today's session is really going to be a discussion between Hillary, Marisa's words, and myself, so that you can hear about how our experience in DC was really life-changing for all three of us personally, but also in terms of how we're thinking about making an impact for kids and families in the state of Vermont. So can you pull down the screen share? And Hillary, I wonder if we can spotlight you so you come to the top of the screen here.
When I speak, do I show up on people's screens?
Can you all see Hillary? Okay, beautiful. So, you know, we have a couple of discussion questions again, and I'll be essentially moderating some of this, but also speaking for Marisa using some of her words. So the first question that we wanted to talk through, and Hillary, I'll have you go first, is what did this experience mean to you? What was most powerful or inspiring for you about this trip?
Thank you, Morgan. So just a brief introduction. My name is Hillary Watson, and I am the Family Engagement Coordinator for Children's Integrated Services in the Child Development Division, and feel so fortunate to be able to share parts of this incredible journey and experience with you all. So sort of opening, right? There are just so many things that stood out about this trip, and some of them I may have the opportunity to get more into, but I think what was so powerful for me was actually something personal and something that I didn't really know the impact of until after my trip. And so it was so powerful for me to be able to come home from DC and tell my 4-year-old daughter that I got to share parts of my work with people that make very big decisions for the whole country, right? And I got to show her images of the Capitol building, which you see on the news, and I got to say, Mommy was there. And I felt so proud of just stepping out of my comfort zone and, you know, doing my best to carry forward messages from just the incredible families and providers and network here in Vermont that make up the CIS system. So it just felt like a really inspiring and confidence building message to be able to give my young child, right? And that in that experience, it was hard, right? I took time away from her and the family to do something that was really important. It was important for me personally and professionally. It was really important for the system that I work with and for. It was important for children and families and early educators here in Vermont. And it really gave me a deeper desire to help strengthen the pathways that we have for people to partner and be systematically included in systems work. So I often talk in my role with families that are wanting to get more involved. And we just really have to acknowledge like the ask that we're making, right? And that it does take the time, time away from family, time away from work and other parts of life, right? And it can mean sort of stepping outside of comfort zones or familiar environments. But I think that we really just have a responsibility to ensure that we have mechanisms in place to compensate family leaders and reflect back the value and outcomes of their feedback, their actions, and their leadership. Right. And this may go without saying, but in sharing my story, right, that value and that experience can have impacts that are professional, personal, right, for individuals as parents and caregivers. It can impact systems. And it really is about opening doors and helping folks think about what is possible for the future, which is one of the many things that this trip did for me as a professional and as a mother of a young child here in Vermont.
Thank you so much, Hillary. I just want to honor the fact that this session is going to be emotional. I am going to be emotional speaking on behalf of Marisa, and it was just such a life-changing trip, I think. So I just wanted to let folks know that we appreciate you kind of sitting in this place of discomfort and how hard it can be to talk about your story and what that means for families and individuals with lived experience too. So when we did a reflection on what this experience meant for Marisa, you know, one of the things that she said is, I spent so much time evaluating how to communicate this experience to people who were not there and how to convey the power of this trip, what it meant for me individually and how impactful it was for me personally. This was the first time that she was away from her child for more than 4 hours. And what it meant to turn off the apps on her phone to monitor her child's progress and her child's needs, and to have to trust the other caregivers and professionals in her child's life, and what it meant to be in a different state and not have the ability to communicate in, you know, the blink of an eye what needed to happen as this child's primary caregiver. And so she said, you know, it's so powerful and impactful both for the state of Vermont and it's really interesting for me to think about the potential that can come from sharing my experience on so many levels and the magnitude and the importance of it. It felt huge and inspiring and like this incredible opportunity that I can't fully describe. And that I've been ready for that experience my whole life. You know, one of our reflection sessions was, oh, I wish I had more time to help prepare folks to go into this room and what it means. And she just had this beautiful statement that was like, I've been training and working for this my entire life. And she said, you know, long before my son came, I was very vocal about individuals who had not been spoken up for. And when my son came along, I turned into a strong and fierce advocate and really wanted to figure out, how do we advocate for our children? How do I get him what he needs and experience these transitions? And part of the reason that she joined the Vermont Interagency Coordinating Council was to help her son and other kids who may not have a voice or be able to articulate those same experiences. So that this experience overall was so huge and incredibly unexpected. And she's so grateful that she got to spend time with Hillary and myself on this journey and to figure out how we make changes to see how we can use knowledge and these experiences to change services for kids and families. And overall, she said it felt very powerful. She felt heard, and she felt like she truly had an impact on kids and families in Vermont and nationally. And that it was just overall a very transformative and life-changing experience. So the second question is around what you felt was important from a professional development perspective, either about the conference or meeting with the delegation, and what did that broader experience mean, Hillary, for you and for Marisa?
Yeah, so I had sort of two main takeaways that I wanted to share with you all. So the first being that attending the conference really broadened my understanding of equity and what it means to really serve the whole person. Morgan gave a list of folks that participate in this conference, and it is extensive. I felt so inspired to be with individuals that work in so many fields, right? There were folks from housing, transportation, human services, healthcare, education, recreation, assistive technology, faith and religious communities, employment. It was just such an inspiring group of people from across the country that came together to like share and expand upon what it truly means to be included and to have choice over where you live, work, learn, and play. And so one of the really important themes for me in all of that I saw woven throughout people's remarks and presentations was an intentional mentioning of how their personal really influenced their professional path. And it was a really inviting space to explore that. And it felt so important to sort of reflect on our access to this broader community of colleagues and leaders and advocates that we can tap into to draw upon their experiences and their ideas and the incredible work that's happening as we think about sort of the path forward for Vermont. And then secondly, I think it really underscored the importance of relationships, trust, and collaboration, right? Morgan, and through Marisa's words, we've shared a little bit about that. I will just say that so much of my learning this trip actually took place before or after main events, right? And it was in the preparation and in the evening debriefing that my learning was really furthered and solidified. And I think what makes this time so powerful was that we had enough trust built up to really be vulnerable, to take risks, share emerging thoughts or ideas, to begin using, new language, and most importantly, to build one another up. And Morgan, Marisa, and I, we really spent hours talking about what our presentation could look like, which presentations that were a part of the conference we wanted to participate in or listen to, and why, how we would prepare for our own poster presentation, what stood out from the conference that day, what we would say in the delegation meeting and how to best prepare, whether that was personally, professionally, figuring out what we wanted to bring forward, and like what the whole experience meant for us as parents, as Vermonters, and folks connected to the early childhood system. So I think it was just the partnership that was so strong, and each of us really worked and invited one another in to figure out the pieces of information and the parts of our stories that we were best positioned to share. And so really broadly, I just feel like the time spent building those relationships, inviting people in, as well as going out to people and meeting them where they are and working through different perspectives and sharing that space and that leadership in our work and in our communities with families and with colleagues is so, so, so worth the investment.
Thank you, Hillary. One of the key takeaways for me in thinking about professional development and the conference and even the meeting with the delegation was around how your role might change over time. And so I feel very honored and privileged that my role today is to support and provide leadership of the State Advisory Council and to have this really fun and unique role in the state of Vermont. And that was not my role on this trip. My role on this trip was about elevating family and community voice and being a partner in the work and really figuring out what it meant to do that and how to coach and mentor other people to have that same role and what it means to do it together. So that was a big piece of the experience for me. I think, in thinking about Marisa's comments around professional development in this one of the things that she talked so much about was that this conference allowed her to see individuals with disabilities speak and be the voice of that conference, to be a part of the planning, to be the speakers, to be there as partners in the work, to present professionally, and to have some really incredible opportunities for networking, like open and candid conversations with such a diverse range of individuals from all different backgrounds. And to really see that there could be opportunities for her child to be in leadership positions, to think about how to elevate his voice for him and then give him the tools to do this in whatever way that means, whatever type of tools, and how to create the environment that allows individuals with disabilities to be the example of acceptance and involvement, and what it means to truly be a part of decision-making and presenting. So another question that we reflected on is, after this experience, what do you feel most empowered to do, and what are you most confident in? And one of the things that I wanted to share on Marisa's behalf is, she kept saying it's such an incredible reminder of, when we're doing this work, no matter what level of service we're providing, you can't take the humanness out of it, right? Like that it's really about kids, it's about families. And yes, there's policy and there's data and there's services and there's funding, and it's so easy to kind of be focused on the stats and the numbers, but that one of the most important pieces is to remember the extremely invaluable component of keeping family representatives present and centrally involved in every single step. And that this experience for her was a really important example of that. And that, the lifelong impact on these tiny humans that we're working with, it's not just getting them over one hurdle or checking the box for the milestone. It's really this life course impact and this immeasurable opportunity we have to create change and investment that's being made so early on, is really giving hope and encouragement to families and communities, and helping us figure out how we're empowering kids and helping them learn to overcome obstacles and helping them succeed. And that she felt like this was such an amazing experience for her as a parent, as a professional, as someone who is this primary caretaker, to now reflect back on her own experience, her own life, and figure out how she needs to make shifts because of this experience, and where there are additional opportunities for her to elevate her voice. Hillary, anything that you would say you're feeling really confident in or empowered to do after this trip?
Yeah, I just feel so empowered and excited to continue to collaborate as much as possible here in Vermont, both within the CIS system and beyond, right? And to continue building out and connecting our family engagement, partnership, and leadership pathways, which I'm so excited as a part of the PDG application, right? And so just a little bit of information too about how Marisa and I got connected, right? So she took the time to complete the CIS Early Intervention Family Survey, which happens on an annual basis for us. And in that survey, she did two things. She shared about her family's experiences in the comments section, and she checked a box that she was interested in getting involved or learning more about the program improvement work. And so one of the greatest parts of my position is that I get to read each and every one of those comments and follow up with families that are either interested in getting involved or leave comments where, administrative follow-up could possibly support. And so more often than not, when I follow up with families, they say, I didn't know anyone would read my comments, or I didn't know what would become of it. Or they share sort of a surprise, like, thank you for following up. And that's so important for us to recognize. And Marisa has been such a teacher and an incredible partner in helping us think about the ways that we let every family know that their comments were received and that they matter and that they are woven into a program improvement work.
So once Marisa and I were connected and she, I had the opportunity to tell her a little bit more about the ways that CIS partners with families, right? And that is everything from just sharing more about their experience with me, and I can take notes and we draw upon those in our program improvement work, to advising on special projects. Sometimes we talk to a number of families in a row that are all experiencing a challenge with one particular aspect of their experience. Last year, we had the opportunity to bring those families together and actively revise a system of payments resource that is now used in our system. And there are also focus groups and work group opportunities. And there's also, as Morgan has shared with you all, our Vermont Interagency Coordinating Council, which is our primary advisory group. And after that initial conversation with Marisa, she did something that I tell her time and time again is worth sharing with others. What she did is she asked her CIS team, the providers working with her son, her family, if being a family advisor on the council would be a positive and worthwhile way to improve CIS services. And to this day, I am so grateful that Marisa's CIS team affirmed all that she had to offer and recognized the VICC as a space where her expertise and her experience could lead to positive change, right? And a year later, we are here. She has helped with our CIS Early Intervention Family Survey. We do revisions based on family feedback every year. She has been an active leader and advisor in the VICC. She's helped us think through the information and the ways that we circle back to families and relay to them the ways that their feedback was shared and led to change. And now she's worked with us to elevate family voice on the national level, right? Her contributions have been extensive. So going back to the original question, I just feel very confident that forming strong partnerships with families, with clients, colleagues, and those with lived experience leads to better outcomes. Some important steps in doing that, right, are finding ways that we all can be informed. We can work to build trust amongst one another, connect, encourage, and really scaffold these opportunities for growth, for learning, for sharing. And the Families and Communities Committee and the VICC are two great spaces, among others that exist in Vermont, that are really working to do some of that.
Thank you, Hillary. So we're really excited and proud to share about this work with all of you in the State Advisory Council. And I do want to open the floor just in the last 2 minutes for any questions or comments you have. And again, we'll be hopefully having some other conversations with the Families and Communities Committee and the VICC soon. Any questions or comments from folks?
I don't have anything, just to say thank you for sharing that, and it's really amazing and very meaningful and heartfelt and important. So thank you.
Thank you, Paul. Any others? Folks, either on the SAC or from our community. Any questions or comments?
I agree that that was amazing what Paul said, and also I hope that her son is okay. You said at the beginning, so.
Thank you, Jessica. Yes, we are absolutely sending all of our thoughts to Marisa and her family today. I know that there are a lot of families that are really struggling right now because of cold and flu and RSV and COVID and all of the intertwined challenges that families are facing right now. So thank you all for being here. And again, thank you for taking the time to hear about how critical this network can be to creating change in the lives of kids and families, right? We just talked about family voice and the regional work and data and how we are merging all of those things into one place to inform decision-making and to support advisement at the policy level. whether it's in the state of Vermont or nationally or within our programs. So just want to say thank you to the BBF network. I'm really grateful for all of the work that everyone is doing on this call, and we are hoping you have a happy and healthy and safe holiday season. So thank you for being with us.